Hello viewers, welcome to my YouTube channel. My name is Sister Dr. Juliet Wangui Macharia. I am a gynecologist and a fertility educator and medical management doctor. And currently I'm based in Voi, working at Moi County Referral Hospital, St. Joseph Shelter of Hope, and Savo Hospital. They are all based here in Voi. But I also have time to visit Mother Madea, that is Mikindani, whereby it is run by Sisters of St. Joseph of Mombasa. And I belong to the congregation of Sisters of St. Joseph of Mombasa. And I wish to welcome you all. And I thank all the followers, all the viewers, those who have subscribed and those who are still even asking questions after watching my videos. I'm so happy, and I'm happy that this kind of information is reaching a lot of people, not only in Kenya, in Tanzania, and also some parts of India, and some also in America. So this is a good start, and I feel humbled by all viewers. And please don't forget to subscribe to my channel. Today we are going to discuss about human papilloma virus. Human papilloma virus is a type of virus that is sexually transmitted, but it can also be orally transmitted by those who normally practice anal sex and also oral sex. So it is one of the viruses that is actually dangerous. That's the name I can say. And we have different types of human papilloma virus, more than 100 types. And among these types, we have some specific types which are known in causing majority of cancers, both in women and in men. So human papilloma virus can be eliminated by the body. So majority of people may have suffered or may have gotten this virus, but the immunity of the body normally clears it out. So if you become infected by this kind of virus, and then the infection now persists, that is where the problem is. Or the body is not able to eradicate the virus from you, that is where the problem is. So human papilloma virus is known to cause a number of cancers, and especially in women. We have cervical cancer, and we all understand that cervical cancer is a deadly one. But the good news is that it can be prevented if one is diagnosed early, or we are able to pick the pre-cancerous lesions early, and we are able to manage them. Unfortunate is that majority of our people visit our hospitals very late, when the cancer has metastasized, or it's beyond stage 3 or stage 3 and above. So that is where now the problem comes in. So it also causes vulvar cancer, vaginal cancer, and sometimes also you can get both anal, vulvar cancer. So all these are, the majority of them are caused by human papilloma virus. It can also cause what you call oropharyngeal cancer. So, as I said earlier, for those who normally practice oral sex or anal sex, they can easily get this human papilloma virus. So it is a dangerous virus. And we have seen women dying silently. Women who are hopeless because the human papillomavirus was in them and it remained in their bodies. It was not able to be eradicated. This woman got infected. The infection persisted. Then it progressed to we call them precancerous lesion, or what we call cervical interepithelial neoplasm. Sorry for that. So the moment it persists and it is not eradicated, then it invades. And once it invades into the cell, this lady has a malignance. And that can be either cervical malignance or vulva or vagina, or we can also talk of anal or pharyngeal. However, human papillomavirus, as much as it is dangerous, the body can eliminate. And nearly most of human beings have gotten this virus during their lifetime. And sometimes we may not even know whether we have this disease. That's why, because most of the time it is asymptomatic. It is not like the virus that causes flu. We are able to see the flu. By the time we say that this probably it's human papillomavirus that has caused this is a kind of patient who have visited you, and now you have noted that she has a huge mass in the vagina protruding all the way from the cervix, or she has a mass around the vulva, or wherever. So, cervical cancer, let me start with the cervical cancer. As I am teaching you now, you visit different wards, the female wards in different hospitals, in government, in private. You will never miss a patient lying in those beds with cervical cancer. And most of these who are lying there, they are already in stage 3 or stage 4. When you visit the cancer centers, it is even worse. Then when I look at these women, I normally ask myself, how I wish they knew it before. Because as she lies there helplessly, and majority of these are poor, some cannot even afford the chemotherapy, some cannot even afford the whole management of cancer, then the prognosis is very poor. So the only thing this patient is waiting is death. And sometimes even the relatives at that particular moment, they are not of help. Some of them just run away from the patient, and the patient is left helplessly in the hospital. So, cervical cancer, as I'm talking now, it is the 4th cancer globally. It is number 4, and I told 4, number 4 globally affecting women. But when you look in Kenya, it is actually, it ranks the second. It's the second one after breast cancer. And they actually follow in each other very closely. But we have also some countries in Africa whereby cervical cancer is leading. But I had said that it is preventable. But the prevention part of it is never exercised. Or if it is not exercised, then it is not a serious one. people just do it. Let's just screen women. We screen them, and then what else? Do we follow them up? Yeah. So it's actually very sad. It's just some few years back, young girls were being vaccinated against this virus. But how long did it take? How many girls actually in Kenya, as we are talking now, got this vaccination? Very few. Majority may end up maybe they got only one vaccination. They not get the two. And it is very sad because it just stopped. Was it politically? That's what I normally ask myself. Rwanda is within the East Africa, but it started vaccinating the young girls in grade 6, and it was a must. And they were able to eradicate about more than millions of young girls were vaccinated. Although it's a small country, not big like Kenya, but it is one of the nation, the first nation in Africa to eradicate the cervical cancer in a very big number. They have more than 93 point something, or even as we are talking now, it's even more. Because they took it seriously. They decided, the government decided, together with the Ministry of Health, to work close and the Ministry of Education, making sure these young girls, those who are in school and those who are at home, are vaccinated against this. But what is happening in our own country? It is gone. It is nowhere to be had. And yet people are dying. Last year, I saw a young girl. This was a young lady, that is, 39 years, with stage 4 cancer of the cervix. She didn't last for long. She died after a few days. Then the same month, we got another young girl, very young. I call them, okay, young, not young girls, young ladies, that is, with the stage 2B, and she was around 34 years. When we get human papillomavirus, it can last in your body for about 15 years without sign of cancer. That's why those who visit screening centers often, we are able to pick this pre-cancerous lesion early and treat you. But however, because no one is concerned, no education to our people, people take it just simple. Human papillomavirus is deadly. But once our bodies have enough immunity, we can fight this disease. We are able to fight the disease. The body itself can clear the disease on its own. But if we are not serious, then the infection that we get continues to persist in our body, and then it will later invade into the cells, and then it becomes cancerous. So, is it the time now to raise up our voice and say we need the vaccination back? Is it not the time that we as parents need to help help our girls, raise our voice, so that we become voice of these voiceless young girls, this future generation, so that we can save them from this monster called cancer, and especially the cervical cancer. Different research have shown that cervical cancer, it is a public health concern. So if it is a public health concern, what are we doing? Why do we just watch our people dying anyhow? Why do we have enough cancer centers around? Why do we even motivate the health workers so that they can move to different communities and sensitize people about this, so that we may have the education and then we are able to see the importance of screening ourselves, the importance of vaccinating our young girls. But we're just quiet. Kenyans, where are we heading to? Personally, I'm tired of seeing these young ladies in clinics. They visit gynecological clinics. They are there in the wards lying helplessly. Who is there to save us? Who is there to fight for our generation? Please, don't forget to subscribe. As you follow me, as you continue listening, don't forget to subscribe. So, as I said earlier, human papillomavirus has got different types. So, after research, it is divided, or we classify them in two. We have the high risk, and then we have the lower risk. So the high risk, the most common one is human papillomavirus type 16, which is known actually to be main causative of cervical cancer, and also type 18. So the two of them, they have a risk of causing cervical cancer more than 70%. So 16, 18, these are the most common high risk. But we also have type 33, 35, 45, 58, and many more. All these are high risk type of human papillomavirus. Then we have people who complain of having what we call genital warts. These are like skin tags around the perineal area. It can be within, inside the vagina or outside the vagina. And then sometimes if they are not treated, they grow. They go and they become like a sunflower. You know the sunflower, the way it looks like. So the way the sunflower looks like, that's how, if it infects you and you are not treated, the whole of your vaginal area becomes like a sunflower. So they are tags. Yeah. So genital warts are normally transmitted. They are sexual transmitted. And they can be managed. So people with genital warts, we say they have low risk human papilloma virus types. And the most common one is type 6 and type 11. So we have come across very young girls, 6 years. I once saw a 6-year-old young girl with genital warts. Then we ask ourselves, what was happening? But actually this was a sad story, because this young girl was being raped by her own dad. So probably the dad transmitted this to this young girl. But we have also adolescents with these genital warts. They just see them as just simple things, because they actually are not painful, but they are dangerous. So if you have a low risk human papillomavirus, that does not mean that you cannot have high risk. They can be dual. You can have both of them, or you can have one of them. So it depends. So those young ladies and who have multiple partners, sexual multiple partners. Today you are with this one, after 2 days you have this one. Yeah, you have multiple partners. All throughout your life you have been having multiple partners, sexual multiple partners. Yeah. So you have a very high risk of getting that human papillomavirus. Remember, it is sexually transmitted. And if it is sexually transmitted, the more you have sex from different people, the more you get different types. Today you have type 6. Tomorrow you are given type 18. After 2 months you have types, maybe type 16. After 1 week you have like type 45. So it's a mixture of human papillomavirus. And if your body does not have enough immunity to clear this, because research has shown that if one is infected by human papillomavirus, the body takes 2 years to clear. So if within that 2 years you are still mixing so many types, even the body itself will get confused. Although it will the body really try to fight against any kind of infection in the body. But what helps it to clear is the immunity that you have and also your behavior. Because as much as trying to clear, but you are still moving around, then we call it in Swahili bandika bandua. The body is trying to remove, but you are now, after removal, you put another one. So it's actually not so. As much as we are trying to understand human papillomavirus, but behavior, as we are talking of our young boys and girls currently at home, you as a parent, what are you doing to help these people understand what's all about this? Because human papillomavirus, if you get a young woman at around 45, 50, dying of cervical cancer stage, maybe stage 3, stage 4. Now minus maybe 15 or 20 years ago. So majority of human papillomavirus, they normally infect our bodies at a very young age. This is the teenager age or young adult's age. But it might be because we do not take our bodies seriously. We think we are just object to be used, and especially women, that it can be used anyhow by anybody. With 100 shilling, I give out my body. With 1,000 shilling, I give out my body. And sometimes we kind of hide behind the scenario of poverty. Who said that poverty, can make you be, let me just use this word, so stupid that you just end up using your body anyhow? And these are young girls. Let us try to tell them that no matter the background you come from, don't compare yourself with other young girls or other young ladies in colleges, because that is where they mess up. This one has got thousands of money. I want those thousands of money. But my parent can only afford to give you hundreds. But we want thousands. And those who have thousands, they want millions. So the only simple way to get this money is to be what I'm talking now. But what are the long-term consequences of what you are practicing now? It's actually a tragedy. Very, very sad. When we see these young ladies who are not even married, suffering from this disease. So let us be careful. Let us be serious. Let us own our own bodies and be masters of our own body. Let us reason as human beings. Let us use our own common sense. because human papillomavirus does not choose. It doesn't choose whether you are poor, whether you are rich. It's just like HIV. And human papillomavirus, when you look at the risk factors, I had said already one, that multiple partners, different sexual partners, yeah, that is one. And two, if you are also HIV, yeah, you are suffering from HIV because your body is already immunocompromised. So because of this, the immunity cannot fight the way it's supposed to fight. But again, the human papillomavirus, normally we normally talk of things, we call them oncogene. So the oncogene of human papillomavirus, when it comes or when it's associated with itself with someone who has HIV, normally the prognosis of this patient is normally very poor, very poor. And whether this patient is taking her drugs well, or she has a good number of CD4, and she's healthy enough because she's taking her drugs well. But the moment we have HPV in her body, the prognosis is very bad, despite of the CD4 she has and how well she has been taking her medication. So it's actually a tragedy. So having been immunocompromised is a high risk. And also starting having when you have what we call the sexual debut, when we have young girls starting practicing sexual intercourse at very tender age. And this is sad because young girls are they're just there. They don't care. So because they don't care, they don't understand that at that young age, the cervix, when you are in the adolescent, young adult, young girls, so you find that the cervix itself, normally it protrudes outside. But when you continue aging, the cervix now retracts inside. So because the cervix is actually outside in this adolescent girl, and this young girl is busy practicing sexual intercourse with different maybe partners, yeah, she had one in primary school, she had another one in secondary school, now she's in college, she has maybe one or two. So because of this, she will encounter different human papillomavirus. But she's young, and especially those in adolescence, she's young. So the cancer cells normally like young cells. We call them those cells which are just growing. And the fact that the cervix is outside also. So this young girl will tend, and if during sexual intercourse, yeah, the cervix may be hit, and then it may be injured. So if it is injured, it heals. But remember, she's still young, so it can be injured severely. So that injury and healing, it is injured here. So we have different kinds of cells, yeah, changing. But another very important thing to understand when you talk of the cervix has got two parts. We have the outside part, we call it ectocervix, and then we have the endocervix. Where these two meet, we have a junction, we call it transformation zone. So the transformation zone, so what are my disappointments? Human papillomavirus, as much as people can try to use ways to prevent themselves from sexual transmitted. But remember, you can get it through skin to skin. One having sexual, then from all the way from the vagina, then you move to the mouth. Then for those who are practicing homosexual, you move to the anus. That's why you find this type of cancers are being transmitted by the same virus because of our behaviors. So if we are serious and we are able to change these funny behaviors that we have seen them now, I think that can be one of the way of preventing ourselves from getting this human papilloma virus. For those who go on having kisses, it is not bad to kiss, well and good. But you find somebody had oral sex, and here is he or she kissing you. So you can also get that. As much as it is sexual transmitted, but remember, wait, because it remains there. So let us be careful. Let us be careful. Another disappointment is that whatever change you see in your body, please make an effort of visiting a hospital or any medical practitioner who will be able to examine you and come up with the right diagnosis. We waste a lot of time before we visit the hospital. So maybe you had an acute infection, but now it has become chronic infection because you have delayed to visit the hospital. So when I see young women or elderly women coming to the hospital because they have noted vaginal bleeding when having sexual intercourse, they have noted this bleeding. But when you ask them, for how long has it taken you? Have you seen this bleeding? You wonder. They'll talk of months, they'll talk of years. So that's one of my disappointments, because people waste time visiting witch doctors instead of visiting the right place where we can diagnose this patient very well. Another thing, we have women with persistent lower back pain and the lower abdominal pain, persistent pain during sexual intercourse, persistent vaginal discharge, and some actually they normally suffer from what we call false smell. So sometimes when you see false smell, women come in with a false smell in discharge, then there's a way, if one has cervical cancer, the way that smell. So even if she's sitting near me, you're able to say, even without examining, that smell is actually a type of smell of cervical cancer. So when they find that they can no longer practice their normal activities anymore, maybe they were teachers, they're not able to go to teach. They used to go to market, maybe they can no longer visit, they cannot no longer sit with their friends because of the false smell. Then they know now these things are worse. But when you take their history, they have been having this problem for years and years. Women, why do we waste time? Why do we just sit and wait for worse to become even more worse? Why? Let us learn to know ourselves better, to listen to our bodies. Any change, please visit a nearby hospital. Another disappointment is actually the behaviors that we are seeing now. Young boys and girls practicing sexual intercourse anyhowly, people having multiple partners anyhowly. Actually, human papilloma virus is here with us. Let us be careful. For those who have fallen among these risk factors, please visit different centers which are offering screening and be screened. Let us come so that we can screen you. We have different types of screening. We can use what we call visual inspection through acetic acid, what we call VIA or VILI, or sometimes we can do a DNA of human papilloma virus. And also we can do what we call the pap smear. We take some parts of the tissues from the cervix and then we take them for further investigation. And they will tell us whether you have this kind of cervical cancer or any other cancer. Even if you have a mass at the vagina, a mass at the anal, or any mass around the vulva. Remember, we said they are all caused by human papilloma virus. Even if we have to die, but let us die at the right time. Let us not go and start practicing anyhowly. So lastly, I wish to thank you all for listening to me and continue following me. And even we can listen to the previous videos. Keep watching and learn more about your health. And don't forget to subscribe. May God bless and keep you. I love you all. Thank you.